Okay, this is the case number 7. This is about 74-year-old school teacher who comes to ER emergency department complaining of the pain on his right arm. The requirements are the same. I'm going to set the time and go ahead and start typing the patient note. Okay, 1, 2, 3. Let's go. Pain persistent. This one. Tylenol. Using some at home. Pain is this is important to know. No loss of consciousness before consciousness before and after the fall. No paralysis. No loss of sensation. Not loss of sensation. This is the important part to note. Patient actually gets anxious when asking about delayed seeking medical attention. Medical attention states that his son didn't have the time to take him to the hospital. This is a really important social factor. Negative allergies to aspirin for medications. Inhaler, Tylenol, past medical history. The patient has asthma in probably benign prostate hyperplasia, surgical prostate surgery. Surgery is performed. Social history. No, surgical history. That's surgical history. Yes, social history. And smoker. No alcohol. Drug over. Last 10 years. very important social factor to suspect elderly abuse. Okay, family history. Mm, count and contributory. So patient is not in acute distress. Vital signs was in the normal limit. Head, ear, nose, throat. Normal cephalic, traumatic. What else? Parallel. People's equal, round, reactive to light and accommodation. Ocular, extraocular muscles intact. No bruises, expecting traumatic. Elderly abuse. Chest, long, clear to auscultation bilaterally. Heart, rhythmic, regular rhythm rate, S1 and S2. Normal, no. Murmur, rubs, gallop. Extremities, right arm held against the chest wall, supported by the left arm, which is healthy. Externally rotated and slightly abducted. Non-low represent pain on the middle part of the right arm, as we say, pain and restricted range of motion on flexion, extension, abduction, and external rotation of the right shoulder. Pulses on brachial and middle arteries are normal and symmetric. Turquoise. Deep tendon reflexes are intact and symmetric. Too. I'm unable to assess muscle strengths due to pain. No loss of sensation. No loss of sensation to pain It's still very good and descriptive. So it's the humeral fracture. What supports this evidence? There's a lot of. So right arm 3 days start after fall. Let's switch to arm. Copy. Paste. Paste the same thing. Shoulder dislocation. Shoulder dislocation. Osteoporosis. X-ray of the right arm and shoulder. MRI of the right arm and shoulder. Copy and paste. And you have to exclude density. What is the support of the run of the time that persisted despite taking using two pain localizing of the arm. And pain is relieved. Be rated by norm. Rest. Localize it upper. No. What is the tenderness? Tenderness to upper arm. Restricted range of motion. And the same thing can be copied. Paste. Copy. Paste. So 13 minutes and 17 seconds to accomplish the task, which is not satisfactory result. 10 minutes only 11 in the real board exam. A lot of time spent here. History physical exam. I agree with too descriptive. Maybe half of the information can be skipped, but all of them looks relevant. Humeral fracture, first thing to suspect, shoulder dislocation, another second common cause. And the third is the osteoporosis, including the 74-year-old male. Another diagnosis should be expected: older abuse. There is a special stress on it, like a social history. It's been very descriptively described it here, saying his son lost his job, and it's one of the stress factors. And his her wife died 3 years ago. He's a widower, lives alone with his son. It's one of the situations. And getting anxious. This is specific to stress that she gets anxious when asked why about the delayed help was taking 3 days in delay. This is basically things we have to keep in mind. Yep, the osteoporosis, it's the advancing age is the risk factor. Bone density, or it's the so-called DEXA. So basically that's it. Let's keep working, practicing and practicing. Thank you very much for your attention. Bye.